Hi everyone, good morning. I hope I'm audible and visible. Yeah. So, welcome to this strategy session on how to answer MCQs. And before we start the session, let me tell you all something which I think you should all remember. Exams do not check how many books have you completed cover to cover, right? And exams do not try to verify how many times you burnt the midnight oil. Exams only try to verify how do you handle those fixed number of MCQs in the specified period of time. And every MCQ is like a little puzzle. And an examiner creates or designs that puzzle having so many distractors put into it, having so many traps inbuilt into it. And this means the difference between a good rank and a great rank is not just about what you know. It is only about how are you smartly able to handle those MCQs in a specific period of time. And that is what we are going to discuss today. So what are we going to discuss today in this session? Good morning, Nikki. So in this session, I'm going to help you understand how many questions to attempt, how to handle a factual MCQ, particularly when it's a number-based MCQ, what to do when it's an image-based MCQ, case-based MCQ, and finally, how to manage time during your examination, right? So this is the agenda for today's session. Let's start with the magical question, right? How many questions to attempt? And generally, this is the rule. If you're attempting an exam or if you're attending an exam, then there is negative marking. Usually negative marking is 25% reduction in the mark, right? So whenever there is a negative marking, the golden rule is you have to attempt at least 95% of MCQs. So if you're attending NEET PG exam, the sweet spot, right? The sweet spot is 190 plus MCQ. You attempted very less, please try to attempt as many questions as possible. 190 plus is the sweet spot. And if you're asking me why, historically, every topper has given us this answer. They have always been aggressive. They have attempted more than 190 MCQ. I've even heard toppers having attempted till 198 MCQs. But we know we are all smart people. We are not just going to follow what others do. It is not just about what toppers do. We should also have a mathematical proof to it, right? Why should I attempt more number of MCQs? Let me give you a mathematical proof for that. Okay, let's consider two candidates, candidate A and candidate B. Both have prepared to the same extent. Both have the same cognitive capabilities. Okay, and both know 170 MCQs for sure in the examination. Do you understand this? Hypothetically speaking, they know 170 MCQs for sure. Candidate A is aggressive, right? Candidate A wants to attempt as many MCQs as possible based on this session. Okay, so what he or she does is this person has attempted 20 more MCQs, okay, based on not based on wild guess, based on educated guess. The person is attempting 20 more MCQs, which means totally 190 MCQs have been attempted by candidate A. Candidate B wants to have a safe play. Okay, and candidate B wants to only attempt 10 more MCQs, which means candidate B has attempted 180 MCQs. And both have done educated guess. Let's give them both a strike rate of 50%. Okay, so with a strike rate of 50%, the one who has attempted 190 MCQs would have gotten 180 MCQs right, and 10 wrong answers. Whereas candidate B with 50% strike rate would have gotten 175 correct and 5 wrong answers. So what will be the score of candidate A and candidate B? Candidate A would have scored 710, whereas candidate B would have scored only 695. So what do you think about the difference, right? The difference here is 15 marks. Difference of 15 in the score is going to mean a lot when it comes to rank, when it comes to a PG seat, when it comes to a college of your choice, right? So what is the take-home message for all of you? The take-home message is be aggressive. Attempt as many MCQs as possible. Your aim should be a minimum of 190 MCQs. And when I say be aggressive, I'm not asking you to do a wild guess. It has to be an educated guess. Be present. Be mindful during the examination. Try to exclude choices. Attempt as many MCQs as possible. Right? So that gives the answer to the first question. How many questions to attempt? Now, how am I going to handle factual MCQs? Listen to this carefully. Whenever you're seeing a factual MCQ, it means the examiner is trying to assess your capability to recall, right? The examiner is trying to challenge your ability to recall. And that is why what they always or almost always they do is they always give you a close distractor to the right answer as another choice. What do? They give a close distractor to the right answer as another choice. So look at the 4 choices. You will always see 2 choices to be very similar to each other. For example, hypokalemia, hyperkalemia, right? 0.8 seconds, 0.8 minutes. So whenever you see close distractors, it means one of the 2 is the right answer. By narrowing it down that way, you have increased the probability of you getting a right answer to 50-50, right? Starting from 1 in 4 chances, now it has become 1 in 2 chances that you're going to be right. So always try to find out close distractors and one of the 2 will be the right answer. For example, look at this MCQ. Biochemical features of chronic kidney disease are all except. Right? So do you see any close distractors here? All of you try to answer A, B, C, D. Which are the 2 close distractors? C and D. So you know either C or D will have to be the right answer. Okay. And you know A and B are features of chronic kidney disease. The question is biochemical features are all except. You know A and B are not the right answer, which means A and B are the features. So if A and B are the features, then it should be associated with high PTH, right? Both hypocalcemia and hyperphosphatemia will cause secondary hyperparathyroidism. So what is the right answer here? The right answer here is choice D. So this is what we mean by educated guess. Do you understand this? I'm not blindly going for an answer. I know it is either choice C or choice D, which means A and B are features of chronic kidney disease. If A and B are features of chronic kidney disease, I know both will cause secondary hyperparathyroidism. So I know my right answer is high PTH. Okay, so apart from this, to answer a factual MCQ, one secret ingredient that you should all have in the examination is you have to stay positive. Do you all understand this? To answer such MCQs, you have to stay positive during the examination, meaning you should trust your preparation. You should think, yes, I know the answer for this question. I will have to retrieve the information from all the sulci and gyri that I have in my brain. Okay, so trust your preparation, trace the answer. Okay, so I want you to start excluding choices. Even if that choice A seems to be right, go through all 4 choices. Do you understand this? You have to read all 4 choices, even if it looks like choice A is the right answer. Because in your MCQ exam, they would have given you choose the best right answer. They're not asking you choose the right answer. Choose the best right answer, which means even if choice A looks like it's the right answer, go through A, B, C, D, exclude choices, come out with the right answer. Okay. No, C will not be the right answer. How will you have low PTH Pragati when it is chronic kidney disease? Yeah, chronic kidney disease, it is hyperparathyroidism. Okay. So now, what to do when it is numerical? The same rule is applicable even when it's a numerical factual MCQ. Whenever it's a numerical factual MCQ, look at the question, look at those choices. All extreme values have to be excluded, right? Closely resembling 2 values is what is the right answer. So always exclude extreme choices. Extreme values will have to be excluded. Closely resembling 2 numbers will be the right answer. Okay. So this is about how to answer a factual MCQ. Now, how to answer a conceptual MCQ? What do you do? What do you think you can do when it's a conceptual MCQ? One small clue for conceptual MCQ is always exclude very assertive statements. Okay, you have to exclude very assertive statements. For example, if there is a statement which says always, okay, there is a statement which says always. Please remember, we are handling nature. right? We are handling biology. And in biology, there are always exceptions. So whenever the statement says always or all or never, right? Always, all, never, you should be suspicious of all these statements. Let me show you examples for these statements. If I say all lipoproteins are synthesized by liver, yeah, will you agree with it? All lipoproteins are synthesized by liver. The answer is no, because I know chylomicron is synthesized in the intestine. So whenever it is all, always, never, be suspicious of those statements. Okay, all enzymes are proteins. Is that true? No. What are the exceptions? Ribozymes. Right, 28S rRNA is a ribozyme. It's an enzyme. It's not a protein. It's an RNA. So these statements you will have to think of. Okay, HDL is never synthesized by intestine is a false statement. Okay. Now coming on to case-based MCQ. Okay. Oh yeah. So because it is C, yes, all, whatever you have told is right, Pragati and Krishna, yes, all the following are true except, which means it is low PTH, right? Because low PTH is not a feature of chronic kidney disease. High PTH is a feature of chronic kidney disease. Thanks for pointing that out. Yes, you're right. I'll tell you, Krish Jindal. USMLE question we will discuss. USMLE question, I would say, is answering USMLE question is much easier than answering NEET PG MCQs. But of course, these days NEET PG MCQs are also similar to how USMLE questions are asked. Okay. So if you learn a subject conceptually, you will be able to answer USMLE questions, because every statement there will be a clue, right? Every question that is asked to you is a clue. Every choice given to you in USMLE is a clue. So if you learn a particular topic conceptually, then you'll be able to answer USMLE papers, right? So USMLE is full of case-based and image-based MCQs. What are you supposed to do when it's a case-based MCQ? Step number one, okay, or my suggestion number one to all of you is, do not fumble whenever you see a case-based MCQ. I want you to feel happy that you're being given a case-based MCQ because there are multiple clues there. Okay, so mostly when it's a case-based MCQ, it will be a long stem question. Yeah, the stem of the question will be very long. In that case, what I want you to do is, step number one, read the question. Forget about the history that is given. Forget about the clinical investigation report that is given. First, find out what is the question that is asked. Okay, so read the question, number one. Number two, look at all the four choices. Once you're done with these two, then you will know what to focus on in the stem, right? Without this, if you start reading the question, then you will start focusing on something which is not even necessary for the question that is asked, which is not even necessary for you to disregard the distractors. So what you're supposed to do is read the question, check all choices. Now you know what kind of clues you should pick up in the history, what kind of clues you should pick up in the investigation report that is given to you. So now go back to the stem and read it. Okay. For example, look at this MCQ. 18-month-old female child presented with, instead of me reading about the entire question, what am I going to do? I'm going to read the question first, right? So where is the question? Which of the following would accumulate? And they've given me WBC L-iduronidase activity was low. Which of the following would accumulate? Then I'm looking at choices. Heparin sulfate, keratin sulfate, hyaluronic acid, chondroitin sulfate. In this case, will I even go and read the stem? I don't need to read the stem because I've already been given the diagnosis. I've been given the fact that it is iduronidase activity which is low. And if iduronidase activity is low, any mucopolysaccharide with iduronic acid will accumulate. What are the mucopolysaccharides with iduronic acid? Heparin, heparin sulfate and dermatin sulfate. So in this case, I know heparin sulfate would accumulate. I'm least bothered about the history here. I'm least bothered about the investigation here. I know the answer already. right? That is why follow these steps. Whenever you're given a case-based MCQ, step number 1, read the question part, the final question. What is the question all about? Look at choices, then go and read the stem. Okay. And another fact that I want to give you is, another trick or tip that I want to give you here is, whenever it's a case-based MCQ, please don't focus only on keywords. Okay. If you're going to graze through the question and if you're going to just pick up those keywords and then try to answer the MCQ, that is when you make a mistake. Because those who set up question papers know exactly to give you a keyword which will distract you from the right answer. Do you understand this? So don't look for keywords and phrases when you read the stem. For example, look at this MCQ. This is an FMGE question, right? So if you just graze through the question, you will read alcoholism, and then what would you see? You will go check global confusion. Alcoholism, global confusion, you will end up choosing the answer as Wernicke's encephalopathy, which is the wrong answer, right? That is why what should you do? Read the question, the most common causes. So they've given you a history, they've asked you the most common causes. And if you look at choices, I see delirium tremens, Wernicke's encephalopathy, Korsakoff syndrome, pancreatitis. I know these are the choices which I have to exclude. Now I'm going back and reading. When I read, I see that there is a history of alcoholism for 20 years and the person has avoided alcohol for 2 days, right? That's it. That gives me the right answer. Alcohol avoidance for 2 days. I know the answer is delirium tremens. Do you get it? So it is all about the strategy that you follow during the examination. It is not just about what you know, it is about the strategic move that you take during the examination. And how do you think you will know all these strategies? Right? Not just by watching these videos. These videos, yes, we will be able to give you like 20 to 25 strategies at the end of these videos, right? But for you to refine the way you use these strategies, it is all about practice, right? So there is no shortcut to this. It is just about practice. Practice as many MCQs as possible. And every time you finish practicing MCQs, you would have come up with a strategy for yourself. Okay. For now, for case-based MCQ, what will you do? Step number 1, read the question. Step number 2, read choices. Now you know what are the choices you should be able to exclude. Then read the stem. Do not fall for keywords and key phrases. Got it? Now, what about image-based MCQs? Usually, right, if you see an image-based MCQ, you should jump with joy. Because many a times in an image-based MCQ, the clue will be there in the image, right? In INI-CET, right? Even in INI-CET, I've seen graphs giving you the right answer right on the graph. Okay, so don't hesitate, right? Don't start panicking whenever you see the image, see an image-based MCQ. Clues mostly in the image. For example, look at this MCQ. Okay, so comparative genomic hybridization. Comparative genomic hybridization, painted green represent what? Okay, so everything is there in the image. Let me, yeah. So the image says isolation of whole genomic tumor DNA is labeled with green fluorescent dye. Right? I'm not giving you the information. The question gives you the information that tumor DNA is labeled with green fluorescent dye. And then they say that the reference DNA is labeled with red fluorescent dye. They've told you the process also. What have they done? They've hybridized these probes onto chromosomes. Okay. Tumor DNA is green. Normal DNA is red. They've mixed it. They've spread it on a metaphase chromosome. And then they are asking you, what does painted green represent? If I see green color more, it means it is represented more in the tumor DNA, right? It means that part of the DNA is represented more in the tumor DNA, which means in tumor DNA there is amplification. Don't you think it's very simple? I don't have to know what is DNA. I don't have to know what has happened. I don't have to know what is the cause of this tumor. I don't have to know what kind of tumor it is. Just based on my logical reasoning, just based on how I've read the image, I'm able to answer that. If a part of the chromosome is painted green, it means in tumor DNA it is amplified. So what is the right answer here? The right answer here is B, amplification in tumor DNA. Do you understand this? That is why what should you do? Whenever it's an image-based MCQ, be happy about it. Be mindful of how you read the image. Read the question. Try to pick up the right answer. Okay. And even if it is not in the image, many a times clue will be there in the stem. Okay, if it is not in the image, the clue will be there in the stem of the question. So club the information that is there in the image and the information that is there in the stem of the question, and then try to give out the right answer. Okay. And when it is about image based MCQ, you should always know how to answer an MCQ based on a graph. Right? So many a times in your exam, you would have seen a graph based MCQ. I know many of you are allergic towards graphs, but let me tell you, reading a graph is a skill, right? Which comes easily if you understand that all that you will have to know in a graph is what is along x-axis and what is along y-axis. That's it. That will be there in the graph. So look at the graph, check what is along x-axis, see what is along y-axis, and then try to logically apply the information in the graph. That is all is needed. Okay. So the crux of answering an MCQ in the exam is being mindful. Right? You should not be in an anxiety mode. During examination, please avoid anxiety. Just keep telling yourself, this is just an exam. This is not the only factor which is going to determine my life. I know to determine my life. I am determining my life now. I have to be mindful. I have to trust my preparation. I'll have to collect all the information that I've gained so far. I will be able to answer this MCQ. So that confidence is more important. Okay, so that's about answering an image-based MCQ. Now, we have discussed about what to do for various kinds of MCQs, factual MCQs, conceptual MCQs, case-based MCQs, image-based MCQs, what if it's a graph, right? Now, ultimately, it is dependent on how you manage time, right? If you're going to sit in one MCQ for long, and if you are getting that answer right, but you don't have enough time to answer the remaining 10 MCQs, right? That is a grave mistake that you can do for yourself. So what is more important is time management, okay? And luckily for us, in NEET PG exam, we have time slot wise, right? We have section wise time management, which they themselves have devised for us. So that's a blessing for us. We know in NEET PG exam, the entire 210 minutes is divided into 5 segments. And in every segment, you're supposed to answer 40 MCQs within 42 minutes, right? So this is a blessing that they have given you. But what if the exam does not have such segregation? You segregate it. Okay, if it's NEET PG, you don't have to do it. They've forcefully done it for you, and take it as a blessing. Here, first 40 MCQs, you should answer in 42 minutes. Next 40 MCQs in 42 minutes. This is a blessing. So how are we going to do it here? In this case, I would suggest that the first 25 minutes you use for sure short MCQs, right? First 25 minutes out of the 42 minutes, first 25 minutes for sure short MCQs when you don't have any doubts. You know this is the right answer. Okay. And when you're answering those sure short MCQs, you're not going to devote anything beyond 30 seconds for an MCQ. Right? Not beyond 30 seconds for an MCQ. If you think it is taking more than 30 seconds for an MCQ, you mark it for review. Okay. So that way the first 25 minutes gets over. Now what will you do in the next 10 minutes? In that next 10 minutes, whatever you mark for review, you're going back, you're checking, you're doing educated guess, not a wild guess, right? You're doing an educated guess, you're excluding choices, you're removing the mark for review, you're completing it. The last 5 minutes for those MCQs which are doubtful. And even those doubtful MCQs, what do you plan on doing? Exclude choices. right? You will be able to exclude at least two choices, and you'll end up in the last two choices when you can apply logical reasoning. You can retrieve related information that you have stored previously, and then take that risk and mark it. Okay, so you will have to answer as many MCQs as possible, but what is mandatory, you should have read all 40 MCQs in the 42 minutes. Do you understand this? You should have finished reading all 40 MCQs in the 42 minutes. You should have answered more than 95% of MCQs in the first segment. And you should have reviewed all MCQs which you had marked for review. And you should be very confident that, okay, these are the questions that I've answered. This is the answer that I've made. And this is the risk that I've taken. I'll go back and verify what is the right answer. I'm going to be confident about it. Okay, and even if the first 40 MCQs are not easy, even if you think these are very tough MCQs, don't lose hope, right? You have another 4 segments to catch up. Okay, so throughout the examination, you should pace out your energy, you should pace out your confidence, and you should stay positive. Okay, so that is a secret. Yeah, I'm looking different. Yes, I know. So that is about section-wise formatting. Now the summary here is how many MCQs should you attempt? Minimum 190 MCQs. You can go till even 198 MCQs. And throughout the examination, remain confident, trust your preparation. In every MCQ, you should only exclude choices. Do not go and pick the right choice directly. Okay, because it is all about choosing the best right answer. Always find out similar distractors. One of those distractors is the right answer. Okay, and if it's a case-based MCQ, read the question first, look at all the choices, read the stem, and then exclude choices. In image-based MCQ, clues are there either in the image or in the stem. Okay, but ultimately the one I won't call it as a shortcut. I won't even call it as a tip. I would say the only way to be able to crack many MCQs correctly is to continue practicing MCQs. Okay, so when you prepare for your PG entrance examination, maximum number of hours will have to be devoted only to practicing MCQs. Whenever you watch a video, right, you're watching a conceptual video, you're watching a video on a particular topic, please remember you're finished reading about the topic only after you've worked out at least 50 MCQs on that topic, right? So work out as many MCQs as possible, and taking up mock exam is crucial. Okay, when I say mock exam, the total number of MCQs, the total number of hours should simulate exactly the final exam that you're going to attempt. And write down as many mock exams as possible so that time management comes to you as if it's at the back of your mind. It should be an involuntary action that is happening, right? For the first 40 minutes, it should tell you, okay, my 25 minutes is over. I'm lagging behind. I should buck up. Right? Or yeah, I'm progressing quickly. Let me slow down. Let me be mindful. Let me exclude choices for all those doubtful MCQs now. So all these should be involuntary, built in your mind, and that comes only when you practice MCQs, only when you practice mock exams as many times as possible. Right? So it is not just about hard work, it is more about smart work that will help you to reach the pinnacle of success. Okay, so this is about how to answer an MCQ in a smart way. Hope this helps. If there are any doubts, I am happy to take it on the live chat. Did many wrong by changing the correct answer to a wrong one? Yeah, that happens sometimes. But it's okay, right? It's about the way you have analyzed the MCQ when you started revising it, right? Which means those MCQs you made wrong only because your cognition in that aspect is not enough, right? So it is never too late. You can focus on those topics. That is why Instead of doing this in the final exam, if you do all these mistakes in your mock exams, then on the final day, you will know what kind of mistakes you commit, right? So many a times it'll come to your brain, you'll say, okay, this is what I did in my mock exam. I did it right, but when I went and revised, I made a wrong choice. I'm not supposed to do it now, right? Let me skip changing this answer. So all these knowledge, right? All this knowledge about yourself, all this information about yourself, you will get only when you practice mock exams. Okay. Last year you attempted 190, got 80 minus, I think of suicide after that is. So Aju, it is all about probability. Okay, so you attempted 190 and you got 80 minus, right? And had you attempted only 180 right answer, your mark would have been, had you attempted only 180 MCQs, your mark would have been much lesser than what you got this time. Okay, so this is a probability. When you attempt more number of MCQs, higher will be the score that you get. So thank you. Have a good weekend.